Chairman Scott, Ranking Member Gillibrand, and distinguished members of the Aging Committee, thank you so much for the opportunity to testify today on the critical issue of loneliness among older adults. My name is Andrew MacPherson, and I'm the founder and executive chair of the Foundation for Social Connection Action Network. Established in 2018, we convene a diverse multi-sector coalition of national organizations to develop and advocate for federal policy solutions that address the epidemic of social isolation and loneliness in America. Since our establishment, the Action Network has been honored to play an important role in supporting and advising the policy efforts of Congress on a bipartisan basis, as well as the executive branch. Chairman Scott, thank you for your leadership in authoring the Bipartisan Social Engagement and Network Initiatives for Older Relief, or Senior Act, which underscores the role that the Older Americans Act plays in addressing loneliness. While significant progress has been made here in Congress, of course, our work on this issue is far from over. As you know, social isolation and loneliness among older adults has reached epidemic proportions with devastating combined effects on public health, healthcare costs, and individual well-being. According to the National Academies, 24% of Americans aged 65 and older are considered to be socially isolated, 43% of adults aged 60 and older report feeling lonely, and chronic loneliness is linked to a 50% increased risk of dementia, 29% increased risk of heart disease, and 32% risk of stroke. Beyond its impact on an individual's health, social isolation and loneliness among older adults carries a substantial economic burden to our country as well. AARP, a member of our coalition, estimates that Medicare spends an additional $6.7 billion annually on socially isolated older adults due to increased hospitalizations, emergency room visits, and over-reliance on long-term care services. Chairman Scott and Ranking Member Gillibrand, I have included much more comprehensive analysis in my written testimony submitted to the committee. Fortunately, there are ways, a number of ways, that Congress can ameliorate loneliness and its deleterious impacts on older adults' health and well-being. First, pass the Senior Act. Adding the term loneliness to the Older Americans Act will allow and direct those funds to ensure older adults are more socially connected. Second, and as you know, the Older Americans Act serves as a vital cornerstone for aging services, but demands far exceed available resources. By increasing funding for Older Americans Act nutrition programs and community-based resources like senior centers, older adults can access structured opportunities for socialization, supporting their overall well-being. Additionally, targeted funding for rural aging interventions is essential to address isolation and loneliness in areas with limited transportation and resources. The Administration for Community Living's Commit to Connect program, which Congress created, is just one example of an evidence-based model that can enhance and that should be protected and expanded. Third, strengthening and expanding intergenerational initiatives, such as shared housing programs, mentorship opportunities, and community volunteer projects have proven to significantly reduce loneliness across generations. To strengthen these bonds, evidence-based strategies can be implemented to include socially friendly environments, expanding community programs that connect diverse age groups, and investing in local institutions that serve intergenerational hubs. Fourth, we must promote technology access in this country for seniors. While technology holds significant potential to mitigate loneliness, nearly 22 million older adults today lack broadband access. To bridge this gap, leveraging telehealth, assisted devices, online support groups, and expanded broadband access are truly necessary to address this issue. And finally, of course, Medicare plays a critically important role here in the growing crisis, to address the growing crisis of loneliness and isolation as well. Medicare can, for example, ensure that the annual wellness visit includes routine screenings for loneliness, expand coverage for peer supports and hearing aids, support non-emergency transportation opportunities through Medicare Advantage and other non-medical supports that can enhance social connection and build social capital. In addition to these recommendations today I'm proud to announce the launch of our organization's federal policy priorities for social connection, a comprehensive framework comprising a full 130 policy recommendations designed to foster social connection and end the public health crisis. Chairman Scott, Ranking Member Gillibrand, and members of this committee, the Aging Committee, addressing the epidemic of loneliness among older adults is not only a moral imperative, but it is a critical public health and economic necessity in this country. Together, we can build a future where connection, not loneliness, defines the American experience for seniors. Thank you so much for the opportunity to testify today. I look forward to your questions. Thank you.